This module looks at the gift of care, the first things first. In emergencies, in life and death situations, you need to call 911 right away or your local fire, ambulance, and police. In all other situations, talk with your family doctor and or healthcare team to find out whom to call in what circumstances. In some places, there are 1-800 numbers for telephone, nursing, doctor advice. And your community may also have a 24/7 community services that can help in an emergency, such as a home visit by a doctor or a nurse. These numbers are answered by professionals who will help you determine if you need to go to hospital emergency room, a walk-in clinic, or wait until seeing your own doctor at the next available appointment. In the gift of care, we're going to look at some basic assumptions that will help you in providing care. Later in this course, we will look at how to get help with the care that you give. For now, a few basics for you personally. Caring can be one of the most fulfilling and life-defining things you ever do. You make a real difference in someone's life every day. But it can also helps to remember that the value in nurturing others and ourselves is the basis of all of that caring. This is an opportunity for you and the people that you care for and the people you are caring with to nurture those relationships within your own family and within your own circle of friends. Although it can be exhilarating, it can also be physically exhausting, mentally taxing, and emotionally draining. So it can be both exhilarating, rejuvenating, peaceful, joyful, and awe-inspiring, but there are also the downsides, and we will look at both. Your loved one may be gentle, kind, grateful, and thoughtful, but some will have had life experiences that prevent them from being that way, where they are not always gentle, kind, grateful, and thoughtful. Understanding that does not mean that you have to accept abuse or continuing unkindness. They need to be civil and respectful within their ability, and you can help them understand where those boundaries are. Ask for and accept help when you need it from others. You do not have to do this alone. Neighbors can be helpful, colleagues from work can be helpful, members of your community, your spiritual community, all of these people can be helpful if you ask for their help or accept it when they offer. We've talked about relationships being more important than things, work, and good health, and that's why nurturing relationships is so important. You cannot like everyone, but everyone can be treated with respect, compassion, and excellent health. Let me give you an example of this concept of why relationships are more important than good health. My wife and I had a son, and my wife was pregnant with our daughter. And one of my students had heard that my wife was pregnant again and said, "Oh, I bet you're praying for a girl so that you have both a boy and a girl." And I said, no, we're actually just hopeful for a baby. And then he said, "Oh yeah, that's politically incorrect. Sorry about that. But I bet you're praying for a healthy baby." And I said, "Well, no, actually, we're praying for a baby because if we prayed for a healthy baby and we didn't get one, the first reaction of us as parents and of the people around us in the delivery would be a sigh or an exclamation of pity or sadness, when in fact what we want is everyone around to be extraordinarily happy that we have a baby. So it's not about health, it's not about wealth, it's not about the things we do, it's about the relationships that we nurture. Perfection is not possible in this situation. Perfect relationships do not exist. And so if you start with that, it's much easier to accept some of the ups and downs of a caregiving process. One of the difficulties in caregiving is this belief that giving is better than receiving. And this comes from a Bible source. And whether you are religious or not, you will have heard this idea since you were a child. In fact, the context of this Bible verse was that if you had extra food or clothing or space in your home, that you should share it with others. But over time, people have come to believe that giving in the caregiving role is better than being on the receiving end. This is why many elders would rather eat cat food than bother a family member or neighbor to do some grocery shopping for them. Caring can't be better than receiving because then it is an unequal relationship. Who would ever want to be on the receiving end? It must be mutual, the gift of care, that both people in the relationship are benefiting equally. A summary of this quick unit is to call 911 in emergencies. Only in those situations where it's not an immediate emergency can you call a family doctor, 1-800 number, to get some other type of advice about whether to go to a hospital or whether to go to a clinic or to your family doctor. Your caregiving role. You make a life-affirming difference in the life of the people that you care for. It's a roller coaster ride with both exhaustion and exhilaration. It can be mentally taxing, yet peaceful, emotionally draining, yet awe-inspiring. Your loved one can be quite kind or difficult, worrisome or grateful, or a combination of all of those things within a matter of minutes. Do not accept abuse. Teach people how to be civil and respectful if they cannot be kind and gentle. Again, they are going through the experience in ways that you may not be able to understand, nor what their past experiences, why those past experiences lead them to act the way that they do. Ask for and accept help when it's offered. Some basic assumptions that can help you. Relationships are more important. Perfection is not possible, and it is never better to give than to receive. We'll be moving on to number 3 of our modules, home care examples. We'll see you there.